and the convening that we're doing across these three organizations to really raise attention to issues of gender and health and build a community of policymakers, practitioners, and researchers to really galvanize both evidence and action on gender and health on the African continent. We thought, I know many of you, it's a tough time to organize a webinar because there are so many events. We might be seeing some of you at Women Deliver next week. There was just alone in Cape Town, there was the Feminist Economics Conference and the Health Economists IHEA Conference. There are many things happening on the continent, and it's also the holiday season. So we're really grateful for everyone who could make it. We're live streaming on YouTube as well, so not everyone will be formally joining the webinar. So this is the webinar on funding for gender and health in Africa. We have a very diverse panel that really covers the range of topics from biotech to social movements. Let me give you an overview and a few housekeeping rules before I hand over to our opening speaker. So if we go to the next slide, please, just some quick housekeeping rules. Next slide. Great, sorry, that was me. I will be turning my microphone on mute so that you don't hear my dog barking. But we will be using the Q&A to chat, to submit your questions. When you're not speaking, please put your microphone on mute, and we will be recording this webinar. And we have French interpretation. So for those of you, les collègues en français, il y a des interprétations. There's a button on your bottom right-hand side, and it will allow you to hear the whole webinar in French. Next slide, please. So as I said, could we go back? We're going to do a quick introduce the opening speaker who has opening remarks. We have an exciting panel. There'll be very short interventions that will give you a sense of their organizations, their contributions to gender and health funding on the continent, and a few provocations. And then we'll open up for further discussion before we close. Now let me introduce the speakers. So if we go to the next slide. So we have here, many of you might have seen this overview. We're very excited to have Dr. Gitinji Gitahi, the CEO of AMREF Health Africa, share some opening remarks for this webinar. He joined AMREF in 2015, and he's worked in various positions in health, media, the private sector. He's a renowned leader on the global and regional front with notable achievements, including co-chairing the global UHC 2030 movement, serving on the Commission of Africa's COVID-19 response, and serving as a member of the governing board of Africa CDC, and recently appointed on the board to the Coalition for Epidemic Preparedness, CEPI. He's a very vocal advocate for pro-poor universal health coverage and leads the largest thought leadership convening on the African health agenda. We thought it would be perfect, given his background, to give opening remarks that gives us an overview of his sense of this space. He'll be followed by Dr. Musumi, who is the president and chairman of Africa Bio. Dr. Musumi has a varied career spanning research and development, academia, innovation management, policy work, corporate finance, and entrepreneurship. He's the chairman and president of the board of Africa Bio, which is the nonprofit association of biotechnology industry stakeholders. And he's the current director of innovation and commercialization at the University of KwaZulu-Natal. Let me just quickly introduce the other two speakers. We have Joyce Renee Djani. She's a program officer representing the African Women's Development Fund. Joyce Djani is a member of the National Governing Council of Planned Parenthood Association of Ghana, and also on the board of Purim Africa Youth Development Platform. She's carried out research on the implementation of CEDAW in Ghana and the advancement of rights of intersex people within Ghana's human rights framework. And she'll be joined after that by Liz Tremlett, who's a grant support team manager for Amplify Change. She's also the technical lead on Stigma. Amplify Change is a fund that supports civil society organizations who advocate for improved sexual and reproductive health and rights. And she draws a whole range of experience working across SARHR and HIV. So we really have the range of speakers, what I called it, from molecules to movements. It really will give you a broad perspective of what's happening in this space. And with that, let me please hand over to Dr. Gitahi for his opening remarks. Thank you very much.
Hello, you can hear me clearly, I hope. Good. Thank you very much. And my name, as you've been told, is Dr. Githinji Gitahi, so I'll not need to introduce myself again. And again, I know that I would rather spend this time with the panelists and the people who've joined us listening to experts on this matter. So I'll just make very, very quick opening remarks. The first thing I want to do is to say that other than my day-to-day role, I am a member of the COVID-19 Commission, which supports President Ramaphosa in delivery of his mandate to the African Union on matters regarding Africa's recovery post-COVID-19, looking at the issues of gender and discrimination, looking at manufacturing, and looking at diagnostics and all the things that we need to do to ensure that our continent actually recovers equitably out of the COVID-19. But I also see it as co-chair of the Strategy Advocacy Committee of the PMNCH, the Partnerships for Maternal and Child Health, whose mandate is really to look at health for women, children, and adolescents, which reflects on policy, service delivery, and financing, which is what we're talking about here. So I wear those two hats as I make these opening remarks. For COVID-19 Commission, I do chair the working group on Africa's recovery. So the first thing to say is that it's to applaud this partnership that has been brought together by my colleagues in the working group of gender and stigmatization in the Africa COVID-19 Commission, but also with these partners that have actually been highlighted, that I don't have to really repeat because it's been talked about, the UN University and also the School of Public Health, University of Western Cape. Now, the key issues here is that women, children, and adolescents are critical foundation for any countries or continents or communities' socioeconomic development. Is not our key building block, but their key building block. Yet we know that gender-focused health programming has been very unpredictable. It's been declining, fragmented, and also misaligned to the objectives or priorities of the women, children, and adolescents, of the people whose challenges we are trying to address. Misallocated, maybe distant, not proximal enough to not only to the implementers, but also to the solutions that actually deliver the change that we desire. But we can't give up. There are major efforts that are being taken, and this community of practice is one that makes me proud, that is actually focusing on this issue of addressing financing for gender and health. We know that, of course, we've had recently, I think it's Lancet that published an article saying that the era of universal health coverage, whereas it has a major move forward investments in health, may also have the risk of redirecting or misdirecting all resources that were actually targeted or focused on gender and health to the broader health system issues. Whereas that's also positive, because for you to address the health issues of women, children, and adolescents, You need strong health systems that are equitable. That equitable, or that equitability, that equitable word is really where we are saying that even as we fund the health system, they need to be gender focused so that they address the issues of the most critical segment of our populations. Recently, to ensure that these issues are raised to the highest political platform to actually attract government attention, the Partnership for Maternal and Child Health under the WHO launched what we're calling the Global Leaders Network. The Global Leaders Network was launched by Right Honorable Helen Clark, who is the chair of PMNCH, and His Excellency President Ramaphosa, who is going to lead a team of 10 heads of state who are going to be looking at reprioritizing the gender-focused health investments that are needed, also to ensure that these are also lead into the global negotiations, including the UN high-level meetings that are happening in September. And not only that there are advocacy efforts, but efforts to lead to real change. I know there are also other platforms, the Women Deliver platform, which is coming up next week in Kigali. I will be there. I hope some of you will be there and to meet you there. Secondly, the Women Lift agenda, which is training women in leadership, and also women in global health, which is advocating for women to be at the center of global health. And this is because you cannot replace lived experiences. No level of research can replace lived experiences. So both must work hand in hand. So women must speak on and for of women and the general issue of gender in global health. We must put them ahead in leadership. So these efforts are important. So as I close, it is important to realize that we must be assured that the comments we are going to make here are also going to find their way into the Global Leaders Network, if they are going to find their way into conversations around Women Deliver. They are going to be taken forward as much as possible to the UN high-level declaration that are going to be done on UHC and pandemic preparedness, and also TB, all three which must have a gender focus in the way forward. So I do apologize, I'll need to leave after these remarks, but I thank you all and be assured that whatever is discussed here will find its way forward to these high-level policy forums. Thank you very much for having me, and I now hand it over back to Professor Asha. Thank you, Professor.
Thank you. Thank you so much for giving that overview, stressing the laying out the context. You know, that UN report that highlighted how we are slipping on maternal mortality and women's health, and particularly in Africa. This is a time to really, now more than ever, both for health outcomes and for gender equality, to really galvanize more attention to these issues, and also to be part of this convening and ensuring that although you have to leave, that the AU is and many other bodies are listening and looking forward to keeping the momentum going through all these different events that are happening. Thank you so much for your intervention and your leadership in advocating for these issues, and your allyship in terms of really connecting the dots and making sure that different constituencies are there to advocate for gender and health in Africa. Thank you so much, Dr. Gitahi. And I think your overview is a perfect way to segue into our first speaker, Dr. Musomi, because the COVID-19 pandemic showed us that we need not only communities galvanized on the ground and movements, but really the issue for Africa, the issues around biotech and science really loom to the fore given the vaccine inequalities. So really excited to hear from you, Dr. Musomi, on the work you're doing in advancing biotech as a key part of the gender and health landscape on Africa. Over to you. Thank you.
Thank you, Asha, and thank you, everybody. It's an honor to be here. I think what I'd like to do is to be a bit provocative as a way of starting. Yesterday, I was with some colleagues that are in the life sciences space, specifically biotechnology. health biotechnology. And a comment was made by one of the senior colleagues that we noticed that when we all went to university, and when you go to universities and areas or institutions of learning in the life sciences, the classes are dominated by females, that girls are actually in the majority in most of those undergraduate, even postgraduate. I don't know, this is anecdotal, but at least from my own experience, I can confirm that that's the sense that I get. However, when you look at who makes decisions, who sets the strategic agenda of what innovation or research is going to be done, it is hardly any females in those communities. It's actually the same rationale that established BioAfrica, because one of the foundational motive of BioAfrica was the realization that the reason that in Africa we had the challenges of not having access to vaccines, diagnostics, and the like during the crisis of at the height of the COVID pandemic crisis. It's simply the fact that we are not represented where decisions are made about the agenda for innovation. And if you percolate that down to the actual products and the markets, you can then start to see how these distributions of inequality are perpetuated, even at the level of the delivery of healthcare. So it's no wonder that we don't see much by way of access to healthcare. As long as we are not part of the discussions and the decision-making at the level of doing research, at the level of setting the agenda for innovation, at the level of setting the agenda about which products are going to be developed, we probably are going to have to take a number and join the queue at the back. I've just come back from Egypt at the Africa Health ExCon, where we launched a BioAfrica Startup Index or Startup Stadium. One of the most encouraging or inspiring images that I could recall from there was to see a number of young African innovators setting an agenda for what I think is the future, and also clearly showing us where we've missed the point, as quoted the elders in biotechnology. One particular mention I would like to make is an AI-driven healthcare model, and it has to be a woman that drives it in terms of using AI for diagnosing breast cancer. It turns out that most of the breast cancer mammograms or mammography technologies do not cater for African genotypes, for African breast tissues. As a result, the end point is that a lot of the diagnoses are late. And by the time these are done, it's a bit late. It's not just on this technology, high tech, it's also on the practice of medicine itself, that the training, the body of knowledge that is utilized to train the generations and generations of clinicians does not incorporate this important information, just on a simple matter. The other one that I just want to highlight from the biotechnology perspective, which is again the reason why we exist as BioAfrica, are things as simple as the fact that when you have the challenge of cervical cancer, HPV, most of the diagnostics for HPV and even the vaccines that are being developed for HPV are being done on strains that are not prevalent in the African continent. As a result, they are suboptimal in terms of their efficacy. Another one is the perennial problem we have, such as HIV. HIV, most prevention methodologies for HIV or tools, such as condoms, are designed for men. They're not designed for women. Women do not have a say in any of those issues. And most technologies are as a result of that. You could argue that maybe that's how the market defines what products need to be done, need to be developed. However, from a pure economic perspective, women comprise 50% of most of our societies. So there's actually no real valid argument for focusing on developing tools for male prevention or for male health. And I think as I move by Africa as to why we advocate for an agenda that speaks to doing innovation for Africa, for the African continent, and therefore having to do it in the continent itself. And that a lot of the discussions or dialogues that we see in the health space, biotechnology health space, is driven by commercial sensibilities. Those commercial sensibilities are decided up north, in the global north. And until such time, and this is what we are trying to do as Pan-Africa, until such time that women have a voice, and we have, as a way of trying to contribute to this, started a program from the beginning where we have rising stars and providing the support, because this support is actually not the type of support that you can structure in a formal way, but creating a community of mentors, a community of peers with African women, seeing other African women. We've held the Pan-Africa Convention for 5 years now, and we do showcase some of our women in leadership, not just women in science leadership, but women in leadership in general, because that's important. That's an important touch point. We have rising stars. This is to inspire young females who wonder why and where female disappear to when it comes to professorships. I'm quite happy to see Asha, that she's a professor. That's a species that is near extinction, particularly in the life sciences. I think I would stop at that, and then maybe later I'll speak about the role of females in entrepreneurship, because entrepreneurship is what's going to define how these products are done and how the markets are shaped. And I'll leave it at that. Thank you.
Thank you. Thank you so much, Nalana Mosomi. I think that was an excellent, I feel like each one of our panelists, we could spend the whole hour, and we just wanted to kick off initial remarks to just give participants a sense of the broad agenda we have. And really, I'm really pleased that we were able to include you, because as I said, in the COVID-19 pandemic, it made us all realize how vital for Africa these issues are. And thank you for highlighting the pipeline and the issues of women's leadership and representation, and how it impacts actually the definition of the diagnostics and products that are available. We're going to switch gears, but I think there are linkages between all of this. And we have two speakers who really fund civil society on the continent. And it's great. I know these are very different perspectives, but I think we can link them. It's good to have them in conversation with each other. So please, Renee, we're looking forward to hearing your remarks from your perspective from the African Women's Development Fund. Thank you.
Thank you so much. I hope you can hear me.
Yes, please go ahead.
Right.
Thank you.
Right. Thank you. Right, so I would be sharing about the African Women's Development Fund, what we fund, and issues of health that we address, and our funding opportunity that is currently ongoing. As the opening. So my name is Joyce Renee Jani. I'm a program officer at the African Women's Development Fund. And the African Women's Development Fund, AWDF, is a Pan-African feminist grant-making organization. And we have recently launched our LEM strategy. This is our 10-year strategy. Our vision, as an organization, we envision an Africa and a world where gender justice and freedom and dignity are achieved for all. And our mission is to resource, strengthen, and uphold African women's rights and feminist organizations and movements that strive for gender justice and social transformation. So in AWDF, the changes we hope to see are that African women's rights and feminist movements have access to increased, sustained, and transformative funding and resources, and that African women's rights and feminist movements are self-determining and resilient agents of change, that the diverse knowledge, narratives, and voices of African women, girls, and gender diverse people, and women's rights and feminist movements are strengthened, heard, and valued. And that African women's rights and feminist movements are united, connected, aligned, and supportive of each other, complementing each other's differences as a source of strength. And that African women's rights and feminist activists are healthy, rested, and joyful. So our journey, AWDF, started in the year 2000, and the organization was started by 3 feminists who realized that there were fewer resources for African women's rights organizations. So they decided to do something about it. So beyond grants making, we also support institutional strengthening initiatives, and we support convening and spaces for collective learning and solidarity. Our grantees have been contributing to shifts in gender equality related individual behaviors, changes in laws and policies, and also changes in social norms and practices. AWDF, we are proud to say that we have so far disbursed $68 million to about 1,550 women's rights and feminist organizations in 47 African countries and 5 Middle East countries. So in terms of health, when we take a quick look at our first half of the year 2023, we have approved about 37 applications to the tune of $2,671,760. And out of this, about 51 are health related. And the specific issues that they address, and I think most of them are on sexual and gender-based violence, including sexual violence. And one of the grant types that we launched, the CASA initiative, that is focused on sexual violence. So we had a lot of applications on sexual violence. We are also going to support work around menstrual health, sexual and reproductive health, also safe abortion, access to safe abortion care, HIV and AIDS related work. Again, apart from the grants we have awarded this year or we have approved this year, we have supported other initiatives. Some are still ongoing on cancer early detection and treatment, maternal mortality and morbidity related issues, including fistula, HIV and AIDS and tuberculosis, mental health and well-being, female genital mutilation and other harmful traditional practices, including widow sexual cleansing. We've supported also initiatives on sickle cell and COVID-19. So AWDF supports women's rights organizations. Our targets include women and girls, but we also prioritize women facing multiple discrimination. So including women with disabilities, sex workers, women living with HIV, survivors of violence, refugees, and internally displaced women, and others. So as I said, we have different types of grants. We have the CASA, that is a sexual violence initiative where we are supporting partners in Ghana, Nigeria, and Senegal. We also have the general grants, which supports advocacy work, service delivery, and others. We also have small grants for the commemoration of the World AIDS Day, 16 days of activism against gender-based violence, and International Women's Day celebration. So we are also able to make some emergency grants where necessary. We have the Leading from the South grant, which supports advocacy initiatives. So I'll talk a bit about that. So the Leading from the South grant is currently open. And so if you intend to apply for any of our grants, that is currently open. So this is an opportunity for you. And so for this grant, we want to award grants for amounts between $20,000 to $500,000 per year, and for up to 20 months in this particular cycle. And there are 3 types of grants in this Leading from the South initiative. We have the Pamoja grant, which you can apply for up to $500,000, and the Anansi grant for a maximum of $200,000, and the Yala for $50,000 per year. So you can apply for additional months to make up the 20 months. So AWDF, we received so many applications in a particular round. So we are expecting about hundreds of applications, but in this cycle, we anticipate that we will award 3 Pamoja grants, 6 Anansi grants, and 11 Yala grants. But as I said, this is not the only grants we award. There are other types of grants. So from time to time, we will send out calls for applications. So if you visit our website, www.awdf.org, you will see whatever we have there. So in terms of eligibility, we support women-led organizations that are legally registered for at least 3 years, which means the organization should have been registered before June 2020. And as I said, this is for the Leading from the South grants that we have currently launched. And when we say women-led organizations, we mean organizations that the CEO, the board chair, the CEO and the board chair are both women or non-binary, and 70% of the board members and 70% of the staff are women or non-binary. For this round, we want to prioritize organizations working in Iraq, Jordan, Lebanon, Palestine, Yemen, the Horn of Africa, the Sahel region, French-speaking, Portuguese-speaking, and Arabic-speaking countries. But if you are in Africa or you're an organization based in Africa, you are welcome. And we support advocacy initiatives. When we say advocacy, we mean the various strategies, including campaigning, lobbying, research, communications, alliance building, that are used to influence decision-making and policies. So you can apply for up to 50% of your verified 2022 income. So for example, if your income was $600,000 for the year 2022, you can apply for $300,000 per year. So just my last slide quickly. So the applications are opened, they were opened on 7 July 2023. The deadline for application is 8 August 2023 at 11:59 p.m. GMT. And you can access the application via our website, which I've already mentioned, www.awdf.org. And for more information, we have our webinar happening at 10 a.m. this morning, the French webinar happening at 10 a.m. this morning. When you go to our website, you'll find a link to the webinar. And then tomorrow, 14th July, we have our English webinar to tell you more about this opening. And successful applicants will hear from us in December. So this is what I'd like to share by way of introduction. Thank you so much.
Thank you, Renee. I think our minds are reeling from all those numbers, but it is really inspirational to have someone from the last 20 years that this Feminist Fund has been in action on the continent of Africa with a range of different grant opportunities, the really supporting women-led organizations. And I think that's already sparking some discussion in the chat. It was really helpful to hear from you. Let me segue to Liz. I think it's so valuable to have both of you here, given the backlash against gender, and we know the anti-gender funding that is also being directed to the continent. So the role both of your funds play is absolutely critical. Liz, over to you.
Thanks, Asha, and thanks, Renee, for making those leading the way, as AWF has often been a real sort of challenger of the grant-making environment in the continent. So it's wonderful to follow you, and very much from the perspective of where Amplified Change came from as a a project of 3 organisations, of one of which AWDF was a leader there as well. So Amplified Change is a bilingual French and English challenge fund that supports local civil society organisations in Africa and South Asia as well. And we advocate for sexual and reproductive health and rights with a focus on marginalised groups. So what do? We take funds from bilateral donors and large foundations, and we parcel this up into much smaller grants for civil society. The key words for us are advocacy and SRHR, sexual reproductive health and rights. So if we look at the SRHR element of that, our priorities are the following 5 areas. We're looking at eliminating gender-based violence in all of its forms. We're looking at challenging stigma and discrimination, and that's a very broad area, but might include working with gender minority groups, might include looking at stigma related to abortion, might include stigma relating to other much more sort of medicalised issues, fistula, and so on. We're looking to increase access to reproductive health, so it's advocating for increased access rather than necessarily directly providing services through funding from Amplified Change, but it's looking to advocate to increase access in sustainable ways rather than relatively short-term grants. So we're looking, the 4th area is to remove barriers to safe abortion, and the 5th finally is to improve the sexual health of young people. So those are the 5 priority areas of Amplified Change. And we believe that, and this is based on the experience of our grantees, that the pathways to that change and improvement in the situation are also 5. We work in 5. The first being stronger, more inclusive movements for sexual reproductive health and rights, an increased in individual awareness of sexual reproductive health and rights as a human right, and access to SRHR resources, information and services. We believe that it's about transforming social norms within societies, and then finally looking at changes in and implementation of policies and laws that may already be in existence or need to be developed and got into existence. Sometimes that can be very much around just holding the status quo, and we're certainly seeing that in relation to the sort of clashing with the anti-gender movement on the continent at the moment. So Amplified Change, we've been very busy recently making lots of grants. The next funding window is scheduled to be in early 2024 now, and we give grants across 4 different funding types. The first one being partnership grants, and this is a sort of funding envelope of around 1.5 million across 3 years. I'm talking in pounds here, sorry. And the idea of the partnership grant is to establish groups working with civil society to provide on granting. So we expect a lot of that 1.5 million is going to go to on granting and connect those large organisations to small groups working to foster there is a degree of developing the capacity of those small grassroots organisations. We also have a network grant, that's a 3-year grant, most recently of around £875,000. And that the idea of that network is to support already established networks in any given place, and that some of that money will move down to the grassroots again, and again with that lead organisation supporting the capacity of those smaller grassroots organisations. The second 2 are more direct grant making from Amplified Change. The first is a strengthening grant, which is £200,000 over up to 3 years. And we're looking here to be supporting more established and medium-sized groups seeking to advocate for SRHR beyond their local community, so possibly at a national level or within a sort of in-country region. Finally, we have opportunity grants, and we're about to give 127 of these out. And these is support to smaller groups that and new entrants to the field of SRHR advocacy. We're looking at seeing emergent priorities coming through, and we also extend this grant to organisations that aren't yet registered or organisations that are unable to register because of existing legislation in different contexts. I would just say, following on from that, that demand is incredibly high, and we do use this applicant data, the demand data, to drive our own funding efforts, so that we're able to give as much funding as possible to the sector, and we try to get close to our optimal performance of 83% of our funds coming through Amplify Change going out in grants. We're happy to talk about this huge catalogue of information on SRHR that we sit on as a result of all of these applications that we receive. And I think, you know, it would be really interesting to work with research partners and those developing technologies to see how this data could be used, coming straight from grassroots organisations. So finally, just to say that we will be active at Women Deliver. I have a booth, so please do come and say hi if you're going to be there, and meet colleagues from Amplify Change who'll be able to answer lots of questions you may have. Thank you. Thanks for the chance to speak to this group as well, Ash.
Thank you so much for joining us. So the chat function has been burning up with comments from Isatu and others, reflections on pervasive gender biases across tax, financing, a number of different systems. There were a few questions on COVID-19 and how do we recover. And then I think there's at least one specific question about funding, which I think is better directed if we follow up over email, linking the websites to your grant requirements. So I welcome anyone else to put questions in the Q&A. We have a little bit of time. You can see, I don't know if our panelists can see, there's some very broad questions Isatu has put in there about gender disparities in tax systems and financing strategies, and how do we come out of the COVID-19 pandemic. I wonder if you could reflect, listening to each other. I think it's very interesting. It's so critical we have these development funds strengthening diversity in social movements, and Masomi also mentioning the importance of diversity and inclusion in biotech as well. So I'm hoping coming out of this, there's going to be several advocacy grants for changing the face of biotech, which is what Masomi is doing. I wonder if you'd like to share any reflections on what you think is a key challenge in your field and key opportunity as closing remarks, and after having listened to the other colleagues on the panel. Masomi, over to you first. And I'll keep an eye if there are other questions. Thanks.
Thank you for that, Asha. I think the biggest challenge is the agenda setting. A lot of the interventions tend to be framed within a specific ideology, which, I may sound a bit politically incorrect, but it reflects the sentiments of the global north. I will just go on to say that somebody put up on the charter that cervical cancer for women and girls is an important issue. And I mentioned earlier on that while we have at least 2 or 3 very effective vaccines for HPV, against HPV, these tend to be developed on variants that are dominant in the global north. And that reflects the nature of the market. But from a funding perspective, my biggest gripe is that there is a lot of funding for, and I suppose it's a complaint because I'm a natural scientist. What we would like to see is funding that also goes towards supporting the development of female scientists, because I'm afraid we could do a lot of these things, and until such time that the people who drive the science and the innovation agenda are females themselves, things like breast cancer, things like HPV and all of those things are always going to be done on the basis of dominant markets, on the basis of the return on investment equation from global multinationals. And the funders have to move towards a paradigm that does not see Africa as a charity case, that also does not relegate female scientists from the continent as people who are peripheral to the agenda, put them in the center of the agenda for doing whatever needs to be done. I think that's the main thing I would say. I've put up on the chat that it's hopefully we could put these conversations at the front and center. Diversity in clinical trials is an important one, including African females in a lot of these clinical trials. I think you started out with saying that pregnant women in the clinical trials, these are incredibly important considerations, and it will shape the markets of the future. So as a corporate finance person as well, it's not just a question of doing good, social good. It's actually boils down to even the numbers from a financial return on investment perspective.
Thank you, Masumi. You've covered a lot of ground there in terms of supporting the pipeline, how that influences the agenda setting, and how do we change the terms in which we develop science and mentor scientists, female scientists, and change the footing in which they shape the field and advance gender and health. Over to Renee, and I'd encourage the panelists just to look at the questions. There are some specific questions, Joyce, to you that I think you could answer through the Q&A function. But any reflections listening to, well, you know Liz well, but also listening to Masumi and looking at the chat function, any closing remarks on key opportunities and challenges based from where you're sitting?
Thank you so much. I think my remarks will be on our LEM strategy, our new 10-year strategy, which allows us to do better than we're doing before. And so I think our challenge in the past was the fact that our grant making was quite limited. We're making our grants on three thematic areas: body and health rights, economic justice, economic security and justice, leadership, participation, and peace. But with the new strategy, it's open, and we encourage women's rights organizations and feminist organizations working in other areas to also apply. It also gives us the opportunity to be very flexible. It supports the call for flexible core grants, multi-year grants, participatory grant making, for example, and so many other thoughts that have come from the movement. It also allows us to be able to strengthen the movement and solidarity around the work that we do. So I believe that a number of the challenges that we had in the past, because our strategy was quite limited, is clearly addressed in this new strategy. So if you visit our website, www.awdf.org, you will see our LEM strategy there for additional information. And I just also to quickly comment on the tax issues. I know, for example, in the area of menstrual health, one of the issues that grantees are working on is tax on menstrual health products. It's a big issue, and despite so much advocacy, it's still a very big issue. It's for governments to consider, and I think it's one of the areas I want to support, to say that we need to intensify work around that, and also to push our governments further to consider that, because menstruation is not a choice. Thank you so much.
Thank you. Thank you so much, Joyce. I think we cover every topic on this webinar, and the intersections between sexual and reproductive health and tax issues and the advocacy needed. Thank you for bringing that together, Joyce. I think there's a question on the chat. I think you said you have priority countries, but you welcome calls from all African countries. Isn't that right? Yeah. Okay. So maybe over to Liz, as you've been listening to the interventions and looking at the chat box, anything you'd like to share and reflections given the years, both of you on grant making, what do you think are key challenges, but also reforms that have happened in the field? Thanks.
Thanks so much, Asha. I think there's a real, I think there's, just to talk a little bit to the wider issues and some of the things that Dr. Musumi was raising there. I think there's a real danger, isn't there, of sort of siloing the sector, and I think it's wonderful to be here on a panel with people from the more biomedical side, because I think that's really important that we come together. We see a lot of grants coming through, very similar sorts of things. A little bit we're guilty because we have these themes. But I think, we don't see some of this more progressive stuff. If I look at a funding round, we maybe get 2-3 applications on cervical cancer. We're not seeing those different things coming through, those sort of elements that are, would create demand, would talk to the issues from an advocacy perspective coming through. So I think, there is a danger that, we're very siloed in the way that we're doing things. And I think, coming together and having a greater sort of connection would be wonderful. And I include in that the femtech industry as well, which has been going for about 10 years. And where is it? I think there are big questions to ask there about, how does femtech contribute to this, and how do we feed into that kind of, the development of new technologies based on what we're hearing, and the fact that we have a huge audience that's asking us for funding to improve the situation, and how can we connect that to the research and stuff that's being done around those technologies. So I'm really keen to make those connections and think through those points as well. That's not about anything to do with amplified change. That's just about making connections. So I think the challenges are making sure that we are reaching as broad an audience as possible, that we're touching on as many of the issues that are facing women, men, boys, girls, those more gender fluid in the continent at the moment. So really happy to connect with others around some of those points.
Wonderful, thank you. And there's a question from Linda Sabia saying, what are the reasons for the decline of previous applications? I think you were both saying that there's been an overwhelming demand.
There's not enough money. There's not enough money. That it's not. I would say at least 50% of the cases, and Renee, I'm sure you agree, is that it's not that we're declining because the applications aren't good enough. It's we don't have enough money to give out. We could give out 3-4 times as many grants if we had more money. So please don't be disheartened by your belief in what the change that you want to see. Please don't be disheartened in that. It's just a very, very competitive, unfortunately a very too competitive climate at the moment, and I'm sure AWDF would say the same. Yeah. So it's not necessarily that you've written a bad application, it's just that we don't have enough money to go around. I'm really sorry about that.
So maybe a broader point of amplifying funding in the space, full stop, so that if you're turning down very good applications, and I've been on some of those funding panels, in some cases we have the panel has been able to recommend to broaden the envelope, but clearly there's a lot of we need to do that as well. I hope that answers that question, Linda. Any other burning comments before we close? Just turning the question, any closing with anything additional? Renee, Musumi? We're almost on the hour. We actually only have 4 minutes.
Yes, at the risk of sounding like I'm singing for my supper, I think if there's one thing that today's session has highlighted is the need to create platforms like this And I think for my own BioAfrica is one such a platform where you have a meeting of quite an extraordinary diverse set of players in this space, from scientists to policymakers and the like. And I'd like to extend an invitation again to the community of practice to interact at the BioAfrica. Unlike some of the colleagues here who have grants to dole out, we provide a platform for interaction and engaging and shaping the agenda for the future. And I'd like to again invite everyone to check out the BioAfrica Convention. It's the biggest biotechnology space in the continent at the moment. Thanks.
Thank you so much. So that's a call to action. You know, these are not spaces that the women's movements are familiar with, and that came out very clearly in the COVID-19 research agenda setting process. But it is a space that feminists need to be a part of. So thank you so much for that welcome. And let me just thank each of the panelists for sharing very deep their reflections about funding from their organizations, but quite detailed information about grants, but also their perspectives of how the field has changed. I'd really like to thank each one of you for the time. I know your agendas are incredibly busy, but thank you for making the time for joining us. I want to thank Sylvia and Khadija on the background at UNU for helping us with the technology, the webinar, the social media. These platforms technically there's always someone behind the scenes working very hard. The interpreters also enabling that this is available in French, and also Tima and Molde at the School of Public Health at UWC for doing their part in helping and facilitating. And I saw Dr. Loazi joined at the very last minute. She had to step away. We really value this partnership. Please stay in touch. There's an invitation from Africa Biotech. We are just building this space, so please reach out and join the Google group. And for those of us who are in Women Deliver, we will be there as well. We're launching, we have a session, particularly building on the work we did on COVID-19 and gender. We have a session there. Those are the details amongst so many there. And we look forward to the next conversation with you. Thank you so much for joining. Wishing you a lovely afternoon this Friday, and looking forward to staying in touch. Thank you once again.